Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Burning Tongue, Sciatica, and Infertility in Men with 40+ years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, Herbal AVX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or the disease is chronic. Dr. Jimmy Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Energy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day, late afternoon, for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Now on.
Oh, testing. We're on. Oh, hello, guys. It's me again, Jimmy Chen. Today is December 10th. This is the last seminar of 2025. And Happy New Year and Merry Christmas. Have a good vacation coming up. For the next year, we have something very unique. In the whole year, a lot of new seminar contests is including my special secret combos that will definitely help you get better business and help you get a better treatment result and of course better money. I'm sure you can get that. And all my combos we talked about it before, just now is being updated for quite a lot of different add-ins and modifications, something like that. I'm sure you're gonna like it very much. As for the next year, it will be 2-hour seminar, not like this year, the 3 hours. That's a little bit too much for everybody. But well, we can deal with the 2 hours, save you some time and money, and I can make sure you get a great results from my combos. That's why, because those things I'm using every day for my patients. They're so happy about it, most of them. Okay, let's get on with it. Oh, this is the picture I use in my clinic. I tell people, roll up your sleeves so I can take the pulse diagnosis. But nobody listen, nobody even look at it. So when this is our, let me turn this off. This is our principle. When you tell the patient's constitutional condition is like from the patient's appearance, then you can make up your treatment plan. So you can decide what to give them or not to give them. That's a very, very important principle. That I do that every time. Whenever a patient sits in front of me, I look at their body type and the blood pressure, which I'm going to talk about right away. That will help you to make up your mind, make up your treatment strategy, and with a better result. So look at this. Their body type, this one. Ooh, sorry. For this type is pretty normal. So the blood pressure, if the blood pressure is normal, then we can use anything we like to. It will not cause any consuming of their energies. But for something like lady like this, elder people like this, and young people like this, those people are not suitable for using acupuncture treatment because needles will make them tired more than ever. The needle will consume their limited energy already there. So we should tonify their body with food, nutritions, vitamins to build up their all energy. Then we can use the acupuncture treatment. That's that's written in our ancestors' book, 黄帝内经. For a big guy like this sitting in front of me, I have no doubt I can use anything I want to. The blood movers, 生痛猪鱼汤, anything that they can think of. And the little chubby lady and the chubby guy, I'm free to use anything too, because their body are pretty strong. And we don't have to, most of the time, I never use any 补中益气汤 or 十全大补 or 黄芪建中 for any of those types. But for those elderly, skinny people and skinny young guys, I would. And for a construction worker like that, the first thing in my mind will be the blood mover, like 生痛猪鱼汤 for his joint pain, neck pain, and for 血府猪鱼汤 for his chest congestion or something like that. So things for her, for him or for her, definitely not suitable for him, not for her either. So that's the thing we have to decide when the patient sits in front of you. And that in that way, you get a better treatment result, definitely. And without having all those complaints coming back. Oh, doctor, after taking your medicine, I feel so tired. No such thing. Anyway, interesting, huh? Different people sitting in front of you. We do different prescriptions, and we can expect good results. Yeah, somebody's qi deficiency, low blood pressure, yang deficiency, hormonal for a lady with a menopause condition or men, elderly people or something. This is neutral, and choppy people sitting in front of you, dampness is definitely there. You can test by push his leg. You will see a concave water retention. In deficiency, the blood pressure is low, heart rate is high with anemia. This lady don't eat properly, don't eat good nutrition. So there are a lot of blood mover or even painkiller, 乳香没药 would not be suitable for person like that. Qi stagnation, the blood pressure is low, and the heartbeat rate is low. So we must use something to push the circulation. Even his major complaint is, I injured my shoulder. I have arthritis in my shoulder, which you should find out before the patient tells you anything. Anyway, when the pain, sometimes we have used 十全大补 for the pain. And for qi stagnation, sometimes people will suffer from cancer. Then that will be the time to use 十全大补 for his recovery. Damp heat, just a lot of heat with the dampness, the choppy condition and the water retention, and a lot of a bouncing pulse. Blood stasis, that's easy. We've been talking so much blood stagnation for the past years, and I'm sure you can tell the blood condition easily from the tongue, from the face, from the skin, and you can tell that easily, right? Especially intrinsic is it got nothing to do with this. Body type is from outside, from eating shrimp or peanuts. Okay. I'm sure now you got an idea that what kind of a herbs combination for those people. Right. Yeah, for different kind of people with a different treatment strategy. It's very, very important. They help you get a better results. For example, this gentleman is not suitable for acupuncture. For this guy, you're free to use any long needles to push through her body, to his body. For this young lady, no needles. Just youngsters, they won't accept any needles. That's too harsh for them. So I got a lot of those youngsters coming to my office that reason they came is because they want to grow up. This lady is good enough, but some young boys is not growing properly. So I just give him some kind of kidney young tonification. Just a few days ago, a mother came with with her two sons. They are doing the defending the sword, defend those exercise in a very good way. They grow 4 inches in 6 months, less than 6 months, 4 months. They grow 4 inches by taking my kidney young tonification. And for this elderly woman, she might not want to be inserted something in the needle to her. For this guy, no problem. This guy, no problem. But for this elderly people, then maybe she can even drive for herself. So it's difficult for her to go to your office twice a week or 3 times a week for acupuncture treatment. It's very inconvenient. Not to say for the young lady, she cannot drive. Her father has to just spare time to take her to your office for the needle, which she's so frightened of. Don't do that. So all herbs are all good for all kind of people. That's why I always emphasize we should use herbs more than your needles, maybe. Okay, this is the Bao Guan Mai. We're not going to talk about this. Oh, actually, I use this a lot every day in my office. I use this strong is head and colon. This is bronchitis. This is the heart, eye, fire. This is the liver and foot. Actually, this is the knee joints. And this is the wing, gallbladder, and hip. This is the sciatica we'll be talking about today. And this is the water, is the kidney. If anybody with high blood pressure, really high blood pressure with a pulse like this, that's kidney type. His artery is not hardened. It's not like arterial sclerosis or enlargement of the heart atrophic something. No, it's just a kidney. His normal pulse is very soft and mild, but the Shaoyin heart 7 pulse is big and strong. That's kidney. We have a special formula for that. And this is stomach. I've seen this a lot. Stomach weak. Oh, this is spleen with this abdominal bloated with a constipation. This is the pulse for constipation. I cannot explain it. Looks like they're all weak, but it's for constipation. Interesting. Okay, let's get on with the burning tongue. I don't know who picked up the topics for this. The seminar, I think Tina did. That's interesting. Burning tongue. So what do we get from burning tongue? The burning means the fire. So whenever there's fire, we have to find out where the fire comes from. Tongue belongs to heart or stomach or anything. But not only that, all the 5 organs can create fire. So we must tell from the patient's appearance and from the pulse diagnosis or the ear sign to find out where the fire comes from. Something like this. Look at this guy. This is the chest, the respiratory system. Oh, it's all red. And this is the chest, lung. But look at here. Here's the stomach. So this guy, if his major complaint is the burning pain in the tongue, so this comes from the stomach. I would always ask, hey, do you eat a lot of spicy food? They say, yes, I eat a lot of spicy food. So then, and look at this guy. See this area? See this area? That's the colon. It's all red. See that? So a lot of heat in his the large intestine. This little beans means uric acid. So this guy probably drinking beer with a joint pain. This is the joint. He must have a little back pain. This is the back inflammation too. Now this got nothing to do with the burning tongue, but we can tell this guy have a lot of inflammation, especially this colon area. And this could be the thyroid. And this is the abdomen. But look at this. This looks like a gallstone. And see the redness in the head? That may be indicating his tongue is burning. So look at this is the head. So the head can tell, and this from the chest, he got a lot of heat from the chest, and maybe from the intestine, bad food, leaking guts or something. And mostly this is the stomach. So we might want to clean the stomach fire first, okay? I have a very good combinations for you today. Okay, burning tongue, we might differentiate into excessive heat, deficient heat, spleen, liver, kidney, qi and yin, blood stasis, phlegm here for chappy person, qi and yin, all deficient. That means this lady has been working too hard, spending all her energy, exhausted. Then it appeared the only symptom is, oh, my tongue is hurting so much. I've seen so much of this. Stomach fire, that would be the most direct reason for burning tongue, because tongue is connected directly to the stomach, right? Okay, traditional Chinese medicine, syndrome differentiation and treatment. Never mind all those theories. Red tongue, pain, bitter mouth, deficient. So actually we can tell they have something in the mouth by this pulse. This is the lung and the mouth. So if you see this pulse, weak, strong, anywhere, not necessarily on the right sun, right guan, right shi, anywhere, I would tell them, hey, you have a little bronchitis, you have some inflammation there, and also something in your mouth. I don't know anything. I don't know what's in your mouth, what's wrong with mouth. Maybe the tongue, maybe the tonsil, maybe the virus infection or whatever. We have this pulse, we have lung means bronchitis and mouth. So you get directly, hey, you have something in your mouth. This pulse means when you touch, when you touch the surface, it's very weak. When you keep on pressing down, becomes stronger and stronger. That's this weak, strong. That's the lung pause. Means bronchitis. She might not have a little cough or something, but something definitely will be in the mouth. Something like this, huh? So real heat, inflammation, false fire, or insufficient qi and blood, we can all tell those conditions from the blood pressure condition, from the pulse, the phlegm, for the body type. We collect all those relative information to get a good conclusion of this. But actually, this pulse for a young kid, I put it here because it's a map. It's a map pulse. Map pulse means the respiratory system bronchitis. This is the map. So a kid with that might have a little cough for bronchitis or throat or whatever in his respiratory system. Mostly is the bronchitis. So be careful. To be careful, by saying be careful, it means no ice water. All the youngsters like cold water, ice cream. No. If you don't stay away from cold things, anything directly from the fridge, this will never go away. That's our priority. No cold drinks. Huh? Oh, look at this. Hey, Sam. That's no good. Look at this guy. Stomach fire. See? And this is the allergy area. This is the pelvic. And the neck and shoulder is not too bad, but it's definitely stomach. And also the skin. So this the gentleman has a lot of things in his stomach which might cause a burning tongue. And allergy will too. So by looking at this and combined with the pulse signs later, we'll be able to detect where the fire comes from and treat it accordingly. Huh? Okay. See this guy? Stomach, little bit, not too bad, but the colon is red, and all these, what? Dumai is red. That means a lot of fire. This is the brain volume, which is not very sufficient, a little bit, not enough volume in his brain. He's not very smart. And the colon. But otherwise, he's fine. Not too bad. So his fire might come from the colon. For the large intestine, this is definitely some kind of hemorrhoid. And neck pain with inflammation. This is the time to use my astringent complex. It's so good. Burning tongue. Okay, the first one. You want to change that? Symptoms accumulated heat in the heart and spleen. Well, those are the terms we use in Chinese medicine. Sometimes you can tell yourself, oh, this chubby young lady, not so young, this lady is definitely the damp heat, something to do with the heart and spleen. Or because she's definitely have water retention, right? Red tongue, strong burning sensation, and irritability. Edema. That's so easy to detect. Just, I always look at a patient's leg. Ooh. Today, so forget it. You can push with your thumb against it, and we'll see a concave hole on the leg. Sometimes their legs are dark in the lower part and different whiter color on the upper part. That means water sediment down there. So for this lady, 100% she will have edema, water retention. Poor sleep is a side effect, collateral damage, bitter mouth, thirst, and dry stools, thin yellow tongue coating. Most mouths are sticky. You can say all those things by just looking at this lady. You don't even have to take the pause. By looking at the lady, you'll be able to say so many things, correct? So the pause. So what about the pause? What would be happening to this lady? What kind of pause she might have? Come on, it's a question. Ooh. What kind of pause this lady might have? Deep. You can post your answer in the chat room. Soggy, thick, deep, muddy pause. Deep, soggy, rolling. I don't have rolling pause in my system. Dispersed? Nope. Soggy. I don't have a rolling pause. I have a slippery, thick and deep, muddy pause, deep. Anything else? Slippery? Nope. You all forgot one slippery, deep, large. You all have forgotten of one very important factor, the strength of the pause. Dispersed? No, this lady is so strong, she couldn't have dispersed. Slipping pause in my system, not in your textbook, means brain damage. It's not here. Weak, impossible. Look at that big lady. How could she be weak? Huh? She's so strong. She's like a tank, like a hippo. How can she be weak? This is impossible. Force and slippery? No slippery. And rapid. Pounding, that's more like it. This pause, for she is so chubby and with definitely, no doubt, with water retention. So her pause should be deep and forceful and thick. That's it. Simple, isn't it?